everybody. Welcome back to the Dr. Mike and Shannon Show. I'm Shannon Fanenstein, medical technology specialist with Mazan Medical, representing the Uroval BRS. And we are joined by us with Dr. Mike Bradley. Dr. Mike, for those who are new to the show, please tell us a bit about yourself.
I'm Dr. Mike Bradley. I'm a PhD medical researcher. I'm the Chief Medical Officer of Mazan Medical, and I'm very proud to be able to represent the Uroval or the bulbocavernoso reflex system that Mazan represents out here in the United States.
Thank you very much. And today we're going to talk about kids and incontinence issues or things that parents might want to take note of or be on the lookout for, because we've talked about men, we've talked about women's health issues, but let's talk about something we don't necessarily think about, and that is kids, because there are things that we think they'll grow out of. We're not really sure if there's a problem. And if my son, daughter, grandson, granddaughter, at what age should we start to worry? What signs are we looking for? They might be 10 years old and still wetting the bed. Is that normal? Are they just heavy sleepers? What are some signs to look for? So let's get some expertise going. What help us with this?
Well, I guess I should start off by talking a little bit about my experience with children. With pelvic floor rehabilitation, I've done as young as 6 years of age. I've done as old as 103 successfully, meaning that, these were people that were incontinent and were able to become and find continence and control of their bladder issues or their pelvic floor problems or what have you. When we talk about children, one of the things that I used to do back in the day is, I would do a lot of urodynamics, and urodynamics specifically with children was a very hard thing to do. I used to work with teaching that with Kaiser Hospital and a few of the different groups in Southern California, specifically for pediatrics. And pediatrics urodynamics is I'll just say it's uncomfortable for our adults, very uncomfortable for our children. And the reason is the catheters that they use for that study, they don't make pediatric catheters. And those catheters look awful big when they're going inside of some of our children. So
Are they asleep when this is done?
No, they're awake. They're very much
Okay.
awake when this happens. I'd like to say that we use some kind of anesthesia, but we really don't. And a urodynamics test on a child is almost essentially identical to a urodynamics test for an adult. And let's face it, that's a pretty invasive test. I don't care who you are or what age you are. It's pretty invasive. Now, when we talk about some of these issues that children have, it's funny how sometimes we talk about how they'll grow out of it, right? But sometimes we miss the fact that a lot of our kids are incredibly active. They're in gymnastics, they're in football, they're in these high impact sports, and the possibility of spinal trauma is there.
That's a great point. My son was a hockey player for a while. Hockey's huge here. Hockey, football, those contact sports.
Those impact sports, there's a lot of discussion around concussion, but when you have an injury, sometimes we don't see the symptoms of that injury for several years after the injury has occurred. A lot of our women that have pelvic floor problems might show initial signs of the injury, but it really comes back out 2 or 3 or 4 years later when that injury really starts to present itself as symptoms. So when we're looking at children, sometimes they don't have that much time, to be able to show you that there's a problem. They completely forget that they had an injury 3 or 4 years before, and all of a sudden they start showing signs of, like you said, bedwetting or weak bladder or small bladder, or they're always looking for a bathroom. We as parents have to really be mindful of our kids' habits, and when there are changes, we need to be mindful of those changes. And we want to be able to be communicative to our medical professionals of the things that we're seeing, because I guarantee you the kids, they're not thinking about those issues when they go see the doctor. They're more worried about getting poked in the arm by some kind of a sharp pokey needle thing, right? So, when we talk about some of the children that I've worked with, a couple of things that really stood out is that, when we have significant issues like a child can't poop anymore all of a sudden, that's a pretty significant issue, and that's an issue that would make sense to really seek out your medical professional. But bedwetting itself, and even like a occasional bedwetting, is not a bad thing to have a conversation with a doctor who has an understanding of pelvic floor health. And when we talk about the bulbocavernosa reflex, the reason, and one of the primary reasons that I like it as a test, is because it's painless. We can determine if there's neurological issues or problems without there being the invasiveness of a urodynamics test. So, and it might even stop us from going so far as doing an invasive test like that on a child, when we can test that, oh, there's neurological issues. Maybe we could set them up with an electrical stem based pelvic floor program to be able to offset that patient, that child, from going through full blown urodynamics or one of those invasive tests that may not necessarily be necessary if we already see that there's a significant delay in their neurological response that can direct us to get them closer to a less painful treatment without an unnecessary diagnosis.
And this sounds like it can be done as easily even in a primary care setting.
Yes.
As far as doing the Uroval BRS. And most of the time when you have a peds patient, or a child, you're going to either go to a pediatric provider or a primary care provider. And this can easily and quickly be done in that setting and have the results instantly there to know if there's going to be a problem.
It's a great assessment to the overall diagnostics. It's not the only assessment or the only tool that we use, and nor should it be the only tool that we use. That being said, it is a great tool to be able to maybe direct a problem and say, you know what, this isn't a developmental problem. This is a neurological problem based on some injury that happened several years before when they were a gymnast or they were roller skating and they hit they fell on their butt too hard. It's amazing what can damage that S5, right? When we're talking about, the lower spine. So when I look at these kind of things, my goal as a related practitioner is to try to be able to focus on the best course of action to diagnose, assess, and ultimately get to a treatment protocol. And I think a lot of parents and probably a lot of providers don't think about pelvic floor rehabilitation as a way to be able to help with things like bedwetting and incontinence, how many little girls laugh so hard they pee their pants and then they have to be sent home. That's stress incontinence. That's what that is. Now, could it be developmental? Of course it could be. But could it also be a neurological issue? And that's something that there's only one way to truly test to see if that's the case, and that's using a bulbocavernosa reflex to test those nerves. So I think it's just, as a parent myself, I think it's good to have knowledge when you see your kids having these issues, to understand that not only is there a way to confirm this, but there is also treatment strategies that we can use for children, and providers that understand that, and pelvic floor therapists that understand that can absolutely help kids to not have these embarrassing situations that keep happening. So,
and this is great to hear, because I'm sure this is putting at ease, some minds of parents, because they're, I'm sure, hearing from, friends or family, oh, they'll grow out of it, or, oh, it's normal. Well, you know what? It never hurts to go and get a checkup done and to be able to talk about these things. And, I would recommend even keeping a log of, when is this happening? How often is this happening? That way you can take that into your provider and have the discussion. And yes, it may be a little bit uncomfortable to do it with your child, but we want, our goal is to help you be able to have these issues diagnosed early and to be able to get treatment for your child early. So that way these aren't going into their later teen/adult years.
yeah, I would absolutely say one of the most embarrassing things that could happen to a child is, wetting themselves at school, in front of their peers and those kind of things. I would say the second most embarrassing thing was that they go do a sleepover and they wet themselves at night at their sleepover. And all of a sudden,
Right.
they don't want to do those things anymore. So it is worth it to us as parents to really take that stuff seriously and understand that it may not be a developmental issue. No, it might be. They'll grow out of it. It's possible. But if we can help that child gain greater control faster and do it in a pain-free way, it'd be hard for me to understand why we wouldn't do that for something so embarrassing. So,
Well, that, and I mean, even let's say they're 6 or 8 years old. I mean, just think of the social issues if they can't go to the sleepover or the slumber party because of the fact that they are having to go over there in the overnight diapers. I mean, they're not going to want to be able to do that. So no, thank you very much for your insight on this. Again, we're not here to give you any advice on medical treatment. We're just here to provide information for you. So that way you can have that conversation with your provider. Dr. Mike, any other last words?
I just want you to, you as parents that might be listening to this to know that I have a child myself, and I think about these kind of issues, and I want to make sure I'm doing things that make it easier for my kids to go through life. And this is one of the things that I would take seriously and look for the help if that's what's happening. Look for the people that understand this issue and can do something about it. We're not your provider. You talk to your provider, but also know that there are ways we can go to help people out. And I think we're just improving quality of life for our kids, and there's nothing better than that. So,
And Dr. Mike's helped children as young as 6 years old. So it's not something it is uncommon, but it's not something that is unheard of and does not have a treatment option. So again, thank you very much for your time. And we wish you a wonderful day. Please make sure you like, subscribe, and share with your family and friends this information because it may help somebody's child. So we really appreciate you, and you have a wonderful day.
bye bye.